Hi, my name is Ashlee Bates. I'm a student nurse practitioner taking care of you today. What brings you in today?
I got a physical.
Okay. Do you have any complaints or concerns that we need to discuss today?
No.
Okay. And how old are you?
41.
41? Okay. Alrighty. Well, I'm going to draw the curtain and shut the door to allow for privacy. Then I'm going to come over here and wash my hands. Alright, so I have a 41-year-old Caucasian male in no apparent distress, looks well nourished, average height and built, and well kept. So I'm going to start with your hands. So if you'll just hand me your hand. Skin turgor is good. Cap refill is less than 3 seconds. Skin is warm and dry in bilateral upper extremities. No clubbing noted of the fingernails. And skin color is appropriate for ethnicity. Can you squeeze my hands, please? Grip strength is 5 out of 5 bilaterally. And put your arms up like this. You push and pull. Very nice. Put your elbows up. And don't let me push down. Very nice. And try to push down. Okay. Very nice. Strength is 5 out of 5 in elbows and shoulders bilaterally. Alright, so I'm going to check your radial pulse. Radial pulses are 2+ and equal bilaterally. Brachial pulse. Brachial pulses are 2+ and equal bilaterally. Sir, can you make a fist with both hands? Open them up all the way. Rotate with your wrists, up and down with your elbows, all the way around with your shoulders. Do you feel any pain? Full range of motion. I'm going to check that shoulder one more time. Any pain there? No? What about this one?
No.
Okay. Full range of motion, notice to hands, wrists, elbows, and shoulders. Just relax your arm. I'm going to check your biceps reflex. And relax this arm. Biceps reflex is 2+ and equal bilaterally. The triceps reflex. Triceps reflex is 2+ and equal bilaterally. Can you touch my finger? And your nose? My finger? Your nose? Finger? Nose? Finger? Nose? Finger? Other hand? Touch my finger? Your nose? Finger? Nose? Finger? Nose? Finger? Nose? Finger, nose. Okay. Can you put your hands flat down on your lap and then flip them over and rotate? Keep going. Okay. Rapid movement test and finger point-to-point test is performed normally. So I'm going to check for your central lymph nodes in the axilla. You may have a little discomfort. Please tell me if this hurts. No axillary lumps or tenderness noted, no central lymph nodes felt. I'm going to come over here and wash my hands again. Okay, just going to palpate your scalp. No lumps or crevices noted in the scalp. And I'm going to listen to the temporal arteries for any bruise. No temporal bruise noted. Sir, can you raise your eyebrows, please? And clench your eyes shut. Smile. Clench your teeth. Frown. And puff your cheeks. No difficulty raising eyebrows, clenching eyes, smiling, frowning, or puffing the cheeks. Cranial nerve 7 is intact. So I'm going to take off your glasses. Palpate the sinuses. Any pain with that? No pain upon palpation of sinuses. So I'm going to feel whether you feel sharp or dull pain. I'm going to touch you. If you'll just shut your eyes and tell me what you feel there.
Dull.
Dull pain.
Sharp.
Sharp pain.
Sharp.
Sharp pain.
Dull.
Dull pain.
Dull.
Dull pain.
Sharp.
Sharp pain. Sharp and dull sensation noted to forehead, jaw, and cheeks. Cranial nerve 5 is intact. I'm just going to take a look at your eyes. Sclera are white, conjunctiva are pink and moist. Corneas are clear, and irises are round bilaterally. I'm going to dim the lights. Look at pupil reaction. Okay. Pupils are equal and reactive to light in both direct and indirect light. So I'm going to turn the lights back on. So I'm going to have you look at the door, and then look at my finger, and the door, and my finger. Normal accommodation and convergent noted with both pupils. Cranial nerve 3 is intact because of the accommodation and convergence. All right, sir, now I'm just going to take a look at your eye. Red reflex is visualized, retina is intact, vessels are intact, and optic disc is visualized. I'm going to go this way. And again, red reflex is visualized, optic nerve intact, optic disc intact, retina intact, and vessels are intact. Sorry, I'm going to say some, here, you can put your glasses back on. I'm going to say some numbers in your ear if you'll repeat them back to me.
8.
8 is correct.
12.
12 is correct. Gross hearing test is normal. Cranial nerve 8 is intact. I'm going to have you follow my finger, please, sir. Okay. Able to follow finger with no issues with eye movement. Cranial nerve 4 and 6 are intact. Can you hear that equally in both ears or better in one or the other?
Both.
Okay. Weber test is positive for normal hearing in both ears. Now I'm going to take a look at your ears. Auditory canal is clear with appropriate light reflex on the tympanic membrane. Tympanic membrane is pearly gray and intact. Again, auditory canal is clear with appropriate light reflex on tympanic membrane, and tympanic membrane is pearly gray and intact. If this was a pediatric patient, I would have the patient in the parent's lap to ease their comfort. pediatric or infants have a flatter rather than S-shaped auditory canal, which can make the light reflex more diffuse on the tympanic membrane. And then young children crying can actually cause redness of their auditory canal. So I would need a pneumatic otoscope to test for movement of the tympanic membrane. So I'm going to take a look in your nose. We'll just look at it. Nares are patent, bilaterally, no deviation noted of the nose. Do you have any change in your smell? Okay, no change in smell. I'm going to put some gloves on so that I can palpate the roof of your mouth. You'll just open your mouth for me. Hard and soft palate palpated with no lesions. Noted teeth and gums are intact. The tongue is at rest in the bottom of the mouth. Cranial nerve 12 is intact. So I'm going to take off my gloves now and come over here and wash my hands. All right, I'm going to have you open your mouth, stick out your tongue and say ah. Okay? No deviation of the tongue is noted. Cranial nerve 9 is intact. Uvula movement is upward with no deviation. Cranial nerve 10 is intact. Tonsils are 1+ and noted. Do you have any pain in your neck? No? Okay. Bend your head back and down to your chest and look side to side. Full range of motion of the neck is noted. Neck is symmetrical. Trachea is midline, no goiter noted. I'm going to palpate the preauricular lymph nodes. No lymph nodes are felt. I'm going to palpate the submandibular lymph nodes. No lymph nodes are felt. The submental lymph nodes. No lymph nodes are felt. The posterior cervical lymph nodes. No lymph nodes are felt. And the supraclavicular lymph nodes. No lymph nodes are felt. Can you shrug against my, thank you. Shoulders are able to shrug against resistance. Cranial nerve 11 is intact. I'm going to feel your carotid pulse. Carotid pulse is 2+ and equal bilaterally. I'm going to listen for any bruise. No bruise noted in the carotid arteries. I'm going to visualize the chest now. Skin is warm and dry. There are no lesions noted on the chest cavity. Anterior to posterior diameter is appropriate. Breathing is normal and regular and non-labored with no accessory muscle usage. And skin turgor on the chest is less than 3 seconds. Okay, so I'm going to come around here and look at the back. Skin is warm and dry. No lesions are felt in the back. Sir, I'm going to see your chest expansion. If you'll just take a nice deep breath for me. Chest expansion is equal. Any pain upon breathing? You're going to feel me tapping back here. I'm going to percuss the back in the 6 locations. Do you have any pain? Okay. Percussion's performed with a resonant sound over the lung fills. I'm also going to do percussion over the costovertebral angle. Any pain? Percussion performed over costovertebral angle with no pain. I'm going to take a listen to your lung sounds now, sir. Just breathe regularly to start with. respiratory rate is 12 breaths per minute. Deep breath. And one more. You're going to feel me listen right here in 2 different locations. Deep breath. And on this side in 2 different locations. Deep breath. Very nice. I'm going to come around to the front and listen to the front as well. Just breathe normally. Deep breath. Breath sounds are clear and equal bilaterally. Okay, sir, I'm going to have you lay down with your head on the pillow. Put your head. Look at the wall there. Okay. If able, I would have pulled out the extender on the bed for his legs. I'm just going to palpate for the apical pores. I'm going to listen to the heart sounds. The atrial area is at the right second intercostal space. Pulmonic area is at the left second intercostal space. Erb's point is at the left third intercostal space. The mitral valve is at the fourth intercostal space on the left sternal border. And the tricuspid valve is at the fifth intercostal space medial to the midclavicular line. I'm just going to count a pulse rate. I'm going to go back and listen to the heart of the bell. Second right intercostal space. Second left intercostal space. Third left intercostal space. Fourth intercostal space at the at the left sternal border. Fifth intercostal space at the medial to the midclavicular line. I'm going to listen to the abdominal aorta, as well as the renal arteries. Apical pulse is 68 beats per minute with regular rate and rhythm. S1 and S2 is both heard. Note S3, S4, bruits or murmurs noted. Abdominal aorta noted with no bruits, and bilateral renal arteries noted with no bruits. I'm going to start to assess the abdomen now. Skin is warm and dry. Abdomen is symmetrical. Sir, can you lift up your head, please? No sign of hernia or pain upon lifting of the head. So now I'm going to listen to bowel sounds. Normal bowel sounds are heard. Let me know if you feel any pain upon palpation, sir. pain or masses noted upon palpation or percussion of the abdomen. I'm now going to palpate the liver in the right upper quadrant. Liver is palpated with clear borders, and the spleen in the left upper quadrant. Give me a deep breath in and out. Unable to palpate spleen upon palpation. Femoral pulse is 2 plus and equal bilaterally. No inguinal lymph nodes felt upon palpation. Bilateral lower extremities are symmetrical. Do you have any pain, sir?
No.
Any pain over here, sir?
No.
Skin is warm and dry. No lesions noted. Sir, can you lift your foot off the table? And push down. Okay, push back with your foot and out with your foot. Thank you. Can we do it with this side? Okay, and push down and back and out. Strength in lower extremities and ankles is 5 out of 5. Just going to palpate the posterior tibialis. Posterior tibialis pulses are 2 plus and equal bilaterally. Dorsalis pedis pulses are 2 plus and equal bilaterally. So I'm going to lift your knee up here. I'm just going to test for range of motion. You have any pain with that, sir? And what about this side? Okay. Full range of motion noted in hips, knees, and ankles. All right, so I'm going to have you go ahead and sit up, please, and bend your feet. Just right there at the knees. There you go. Patellar reflex is 2 plus and bilaterally. Achilles reflex is 2 plus and equal bilaterally. Babinski reflex is negative bilaterally. I'm going to have you stand up, please, sir. You can stand right over here. Can you bend over just a little bit, please? Normal curvature of the spine noted. Bend backwards. Very nice. And side to side on the full range of motion. Do you have any pain with that?
No.
Full range of motion of the spine is noted bilaterally. All right, sir, can I have you walk to the wall, please? And come back and put heel to toe as you walk. Very nice. And go back to the wall on your tiptoes. And come back to me on your heels. Very nice. Normal gait is noted. Tandem walk, toe walk, and heel walk are all done without difficulty. And so I'm going to have you scoot back just a little bit. Okay, and then I'm going to have you shut your eyes. Negative Romberg sign noted. And so thank you.